Good morning.
Good morning. Thank you for having me this morning.
Thanks for being here. Now, you and I first chatted about this about a year ago. At that point, you said we were nearing a state of crisis. How would you characterize things now?
Yeah, I wish I could say things have abated, but they haven't. We continue to have this crisis in front of us locally and provincially, and it becomes more and more desperate for us to reach out to the community to say, please help where you can. We really do need local foster homes to support those children youth we're trying to serve.
How have the conditions changed in their living arrangements? I'm thinking specifically with the hotel. How has it changed in the last year? Is it getting better?
Yeah, no, unfortunately it's not. The number of children and youth on unlicensed placements is growing. And while our initial crisis, the struggles were with those really complex acuity needs, children and youth who have presentations of really challenging behaviors, we're actually now at a point where we are looking for foster homes for those other children and youth that just maybe have experienced some trauma in their life and for whatever circumstance need to come into formal care. We're struggling finding appropriate homes for those children and youth.
We had talked about earlier how some of these children would have to be moved out of our community to try and find them proper housing. Is that still the case?
Yes, we still continue to search for what hopefully, really the best match for a child in terms of what their needs are and how we can provide the care we need. And unfortunately, we don't have those kinds of placements available in Windsor, Essex. So where we can, we do find homes outside of the area. But that in of itself has become a real struggle because it's a similar story across the province. We have a number of CAS looking for placements for children and youth. And so locally, certainly we are continuing to try to build capacity around that. And I'm optimistic. We've got some good things happening with the community and some of our partners like Maryvale and trying to design a program that'll support our children and youth in a better way. But it's until we get there, we're really hanging on by a thread.
What other unlicensed areas are our children staying in?
We've leased homes so that we could place children together in homes. And what we try to do is be thoughtful and logical about this. Do we have a sibling group? What can we do to keep them together? Obviously children who are separated from their families go through trauma. And if we can keep the siblings together, that's the best outcome. But we certainly are using those residential homes that we have been leasing. We do still have some youth in hotel, and we've managed to, in partnership with Maryvale, secure one of their cottages on site where we've been able to place some children and youth there as well.
The cottages are new. How long have you been leasing those out?
The first cottage we've started leasing a couple months ago, and we have designs for a second that'll be coming up shortly. I'm hoping within the next couple of weeks, because we really are at this crisis. Probably have about 71 foster homes right now, but each one of them is likely full. So we probably maybe have in our whole system about 4 beds available. And with the greater number of children between the age of 0 and 12, although we need foster homes for 0 to 17. And so as we see a number of homes closing, we're not able to replace those homes at the same pace. And so we're closing way more homes than we're opening at current pace.
And the ones at Maryvale, how many kids can they house?
The cottages are designed, historically, they've been set up as like 6-bed cottages. But you have to be consideration to those mix of children and youth. There are some youth whose behaviors are such that maybe you can't have them placed with certain other children or youth. And so we won't realize full capacity of those cottages as we're trying to do the best we can to support the children and youth. But what I'm hopeful for is that we can at least utilize 50 to 75% of those beds.
How are workers doing?
The workers are exhausted. Honestly, my staff are amazing. They have been supporting these children and youth 24/7. After a long day of work, taking on extra shifts, coming in the evenings and the weekends. They do it because they have a commitment to the children and youth that we serve. But that has a shelf life for all of us. The level of exhaustion and I think they just need a break. And so we're looking for some additional supports in the community. And, any community member that's willing to come forward, call us, 519-252-1171. Ask to speak with one of our recruiters. Go to www.wecast.on.ca. We have a virtual session, actually, for recruitment happening tomorrow afternoon at noon. So go on our website, call our number, speak to our recruiters. Rebecca and Justine will be there to support you. And really, we're looking for our community to help out.
How far away are some of these kids having to be sent?
Across the province, we've have children in Ottawa, Stratford area. And again, our purposefulness around that is actually trying to find the best match. But with this crisis as it stands right now, unfortunately, we don't have the luxury of several options. So sometimes you're going with who has an empty bed. Yeah.
Have you had any revelation in the last year as to what the solution is to all of this?
I think we need more community local solutions. We work closely with our ministry. It's a complicated system. And while we have child welfare redesign happening, I'm still really shouting at the top of my lungs that we need full system redesign. So we're really focusing locally for a big provincial problem. I think our local community partners, we've conducted a recent think tank and invited lots of community partners together, and those community partners are calling and saying, what can we do to help? What are the solutions? They might not be able to offer a bed, but they might be able to offer respite care or some support assessments, something to support the children. And so really it's, again, Windsor being Windsor and sticking up for one another. It's a local solution.
Our coverage on this got the attention of Queen's Park when MPP Lisa Gretzky stood up and shared what's happening in Windsor, calling for change. Has anything come of that, or has it fizzled out?
There have been some movements. We've seen some announcements come out of the Ministry of Health around mental health supports for children and youth, and I think we have the attention. It's garnered lots of conversations with me, with community partners, and with our local politicians as well. We have an amazing right now partnership with the City of Windsor and the City of Windsor Housing Authority to support some of our what we call Ready, Set, Go children and youth, those who are discharged out of care when they turn 18, and we're supporting them between 18 to 21, or 23, I should say. And so those children and youth now we have a really solid residence for. So there are some promising things happening. It's just like we need them like yesterday.
Yeah, I was just thinking, I'm not sure it's the pace that you can handle.
Yes.
You can handle it.
Absolutely.
I wanted to happen 5 years ago, but at least there's some movement, because we often wonder, you and I sit down time and time again over the last year, and I wonder, like, is this making any difference having these conversations, or are we just having conversations?
Yeah. It doesn't feel like it in the moment, I'll be honest, because the number of children, youth, and licensed placements has actually grown. And while there is hopefulness and there are some strategies and some investments that are carrying on, in this particular moment, the crisis is still well in our face, unfortunately.
But some change.
Some change,
All
yes. My glass is always half full.
Okay, well, I'll drink from your glass. Thanks so much, Derek.
Thank you so much.